Hi, everybody. I'm Leslyn Keith, and I'm here again with you as I am twice a month to talk about research. So we're doing research updates that have to do with lipedema. And so I have several papers that I look at and I give you more information about them and tell you what's going on in the world of lipedema research. And so I have a really good paper to go over with you today, but I want to quickly just do a couple of announcements because this is the first day of Lipedema Awareness Month. So we're kicking off today, starting off with talking about some research that have to do with lipedema. But there's a lot of activities happening this month, and I just want to let you know about them really briefly. So the first one is that we have our Lipedema Challenge. So there's a bunch of lipedema activities, challenges, opportunities for learning, getting together with other women and experts. So that's going to be starting on June 7, next Wednesday, 7, 8, 9, 10, and 14, plus some bonus days if you sign up for the VIP. Look below, you will see a link that can give you more information about those challenge activities and also how to register. So, and then another fabulous activity we have this month is our Tribers at the Table. And so this is throughout June, in-person activities throughout the world. I would say mostly in the United States, but we definitely are going throughout the world because we have, I think, New Zealand, Canada, several places outside the United States as well. Go to the link below and you can sign up for one near you. If you do not see an event happening near you, then contact us, and maybe you want to host one near you, and a place that's convenient to you. I just had a contact today with someone is near Toronto, and she said, "Should I do one?" Well, yes, absolutely. So, and this is just getting together at a cafe or any other local area that's a public place, just to have a small group. You might only have 4 people, you might have 15. We don't know. Whoever wants to come is interested in talking about lipedema and sharing. So be sure and check out the link below and get for more information about that. We also have, I'm looking at all the other activities we have coming up. You might want to save the date. In October, we have our heart-to-heart event, our virtual event, conference, symposium, get together, and it's going to be October 27, 28, 29. There are just a few spots left for the super early bird price. It's a very deeply discounted price. Be sure, again, check the links below and get more information about that. I think I've got all my announcements, but if I remember anything else that I forgot, I will do it after. I'm sorry, that I might have just froze right there. Let me say the name of the paper again, just in case you didn't see it. That is Lipedema Research Quo Vadis, and it's by researchers in Austria and Germany. It was published in the peer-reviewed Journal Journal of Personalized Medicine in December of 2022. And this paper is basically a literature review that they were looking at what is the state of lipedema research and what's coming out in the last few decades. They specifically used PubMed and searched for all the most recent papers looking at lipedema. And they really focused on what they were looking at was specifically, they wanted to use studies that were looking at analyzing the tissue. So they wanted to use studies that either had a tissue biopsy, blood samples from participants in their study, or they use studies that went to a repository and stuff that has been collected over a period of time and got access to those materials. So they were really focused mostly on that in looking at the latest lipedema research. But first, I guess I should, because I had to look it up myself. What is the meaning of that title, Quo Vadis? It's Latin, and the Latin for where are you going? So where is the lipedema research going. And I thought that was a really good title. So let's look at some of the results. Some of the things that they found out. First, they were talking about edema in lipedema, and they said that the research that analyzes lipedema fat tissue is very mixed. Some were saying that, yes, there is edema, and others were saying, we're not seeing it. Just froze again. Sorry about that. I'm in a hotel, so my internet may not be as strong as I would like, but there are animal studies that show that lymph can cause a proliferation of fat tissue. And so if there is impaired lymphatics in someone with lipedema, causes that leakiness of the lymphatic vessels and fluid to collect, that causes proliferation of fat tissue in that area. So if you're having it just in the lower body, that leaky lymphatics, then you're going to get fat just on the lower body. And there was imaging studies in lipedema that are very mixed. We have some that say that, yes, there are functional and anatomical anomalies in people with lipedema at all stages of lipedema, and others are saying they're not finding issues with the lymphatics in lipedema. And then they also talk about fluid accumulation and bruising could be caused by blood vascular issues. Well, definitely the bruising would be from capillary fragility or other vascular issues, but fluid accumulation might also be coming from venous disease. And what they don't know is the venous disease part of lipedema pathology, or is it a comorbidity? Is this something that just commonly happens along with lipedema? That is yet to be discovered. Another thing they commented on this paper is that there is a huge search, and rightfully so, for a biomarker for lipedema. We want a blood test, a test for genes, some kind of imaging, something that says this is unique to lipedema. And if we have a positive on this, then we know that this person has lipedema. And so there's been a lot of work on trying to find these biomarkers. Specifically, they looked at a bunch of studies that were examining lipedema fat from either tissue biopsies of the participants, or they were using aspirate from liposuction. So participants who had liposuction, they have lipedema and they had liposuction of that fat, then they were looking at that, doing a really detailed study of that aspirate. And so they had over 20 papers that they were looking at that specifically were looking at that. And they were looking at adipogenesis. What are markers in there that say this is going to lead to expansion of fat tissue? There's lots of hypotheses, there's lots of promise, but nothing definitive at this point. And they were talking about the difference between hypertrophy, fat tissue, or fat cell hypertrophy, and fat cell hyperplasia, two ways for fat tissue to expand. And so hypertrophy means that you do not get any new fat cells, but you just keep stuffing more and more into the fat cells that you have. And hyperplasia is you just keep generating lots of new fat cells. And everything that we're learning now says that hyperplasia, or growing new fat cells, is more metabolically safe. Sorry, my light just went off here. So hypertrophy, where you just keep stuffing more and more into an existing fat cell, is not as healthy metabolically. And so what do women with lipedema have? And so far what we're seeing is that there seems to be a mix. Some have some hypertrophy and some hyperplasia, but the ratio, the balance between those two seems to be very different between each woman. And that may be part of the reason why we have this very unique presentation. We can say in general, this is what lipedema looks like, what it feels like, what the experience of lipedema is like, but it can have a lot of variance. And that might be one of the reasons why, that kind of a different balance between the hypertrophy and the hyperplasia. And they talked about chronic inflammation and oxidative stress in lipedema tissue, and looking at what the articles were saying about that. And this is, again, part of that, looking for that biomarker, because they were wondering if we can find an elevated marker that is elevated, that means there's lots of inflammation. Is that unique to lipedema? And indeed, seems to be a lot of oxidative stress and inflammation in lipedema. What they haven't figured out is chicken or the egg. Do we have a pathology that increases our inflammation, our oxidative stress, that then causes lipedema? Or do you get lipedema and part of the pathology of lipedema is inflammation and oxidative stress? So we just don't know which one comes first. So that was all really interesting. And then they looked at future considerations for future research and some dilemmas that we're facing when we try to do research in lipedema. And one of those is the issue of the patient's weight. And there is a huge range. Just we know we have this very unique presentation across people who have lipedema. And so you recruit people to be in a study, and you say, okay, yes, you have lipedema, but it's such a huge range in weight. And what these researchers were saying was that maybe that is clouding the issue, that we are not studying just lipedema, but we're also studying all the other things that happen when you are overweight and obese, if you also have simple obesity along with your lipedema. And so they said that, you can have, these people are all stage 1 lipedema, but they're normal weight all the way up to morbidly obese, and the same thing for stage 2 and the same thing for stage 3. And so how do we tease out what is lipedema and what is the other comorbidities? And so that is an issue. And then they also talked about edema and vascular or blood vessel disturbances, and why this is so difficult. They're questioning why it's so difficult to figure out exactly what is part of lipedema or part of a common comorbidity. And so they said it's been very, very difficult, as we talked about already, that such varying degrees of finding out whether there's edema in lipedema. And so it seems to be a hard question to answer with lipedema. And so again, another issue. And then the age variability. We can see sometimes an association between what stage of lipedema you're in and your age, but other times not so much. So you can be someone who is postmenopausal and stage 1 lipedema, and you could be someone who is in between, just after puberty, and you're already stage 2 or stage 3 lipedema. So they don't always go together. So again, when we're trying to study a cohort, when we have such a huge variety in age, well, are you still menstruating or not? That's going to have a huge impact on if we're going to test your hormones and see the interaction between your lipedema and some of your blood numbers. And so so the researchers were saying that we really should have some more tightly controlled age range when we're doing studies, so that they would be in a more in a stage of life where their hormones should be a certain way. And now if all of them are not, that tells us something about lipedema, but hard to figure that out if we have this huge age range. And then they also talked about the dilemma of the control group. And so quite often, a lot of these studies are doing, they have a control group of people who have lipedema, and then another control group that are age and BMI matched. And they said it may not be so useful to have them be matched for their BMI or their weight, because now if they are super heavy, are we having issues with the comorbidities with the obesity itself and all the comorbidities of obesity? And is that clouding the issue? We're not getting a good healthy control compared to lipedema. And so they suggested that we have just healthy controls and we do not match for their weight or their BMI. And then they did a little thing about the staging of lipedema, and they do believe that there are stages, but they don't feel like each stage is descriptive enough that it's at least the literature that they were looking at, it was too basic, and it needed to include description of each stage that took into account family history, took into account various comorbidities that are common at that stage, things like that. So they seem to want a little bit more into the staging. And then some things that they also said hamper lipedema research. This is interesting, and I do remember this being discussed before, that there is no animal model of lipedema. And so when we look at lymphedema, you will see a lot of animal research. You will see mice, and they'll give them lymphedema, and then they'll test things on them, and they'll find things out. And before they ever try it on a human, there are no animal studies for lipedema. So either we're doing tests on tissue samples, blood samples, stuff like that, or we're testing on the women themselves because we don't have an animal model to start with. And they also said what we've already discussed is that high variability within a study sample is so huge that you don't really get good data from it. And they feel like that too little attention has been paid to the problem of obesity and as a comorbidity of lipedema. And they would really like to see studies with looking at women who have lipedema and are not obese. So do not have a weight problem along with, so they don't have simple obesity fat along with lipedema fat. So unfortunately, I think that would be a very, very difficult to get a decent sample size when you do that, especially if you want to look at stage 3 or more advanced stages of lipedema. It might be hard to find participants who have that late stage but do not have simple obesity as well. So, and I would just like also to add another issue, and I do believe by reading this paper that the authors do support this, that they were kind of talking around it a little bit, but really we need to have a better agreement for research about what lipedema is, a very good description of lipedema that everybody uses. And then now when we have researchers in Austria and researchers in Italy and researchers in Australia, and they are all running the same kind of study on lipedema. Now we can pool all their data because we know that they use the same definition for lipedema in their study. And now all that data can be more meaningful. So I think that was super important. It was a wonderful paper. I have a link for you below if you want to read it in more detail. They do get a lot into that molecular stuff with the fat, lipedema fat, if you're interested in that area too. But I thought it was really interesting just in the discussion of how do we do lipedema research and how can we improve lipedema research. So I'm hoping that you enjoyed that. And I wasn't even looking at the chat, so I just want to see if I missed anything that I should address up here. And Gail, feel free to pop up any questions you think I should answer. Thank you for saying hello and where you are. Okay, here's a nice question. Now, what about the effect of a GLP-1 meds on lipedema? Is there any planned research? And yes, I do think they're looking at it because there is obesity can be a common comorbidity, although metabolic conditions like diabetes are not so much, but it might be that we're not looking at them in the proper way and not identifying things like diabetes. But what they're finding is a lot of diabetes medications can also be helpful for weight loss. And so I do think that they're looking into that. I just would be very, very careful with it. There are some medications that are now being used to help with people who have intractable obesity. And the problem is that if you ever go off of them, then you can have that huge rebound and have a tremendous weight gain. And that may not be great. And then Winetta says, do you know if a DEXA scan shows any distinction between lipedema fat and lipedema tissue? And you will see a little bit of a discussion of that in this article, Winetta, because they're talking about how there can be crown cells and increased macrophages and stuff like that. And so it seems to indicate that lipedema fat has increased inflammation and increased pathology compared to simple obesity. That is, and with DEXA scan, I'm not sure if they've used that, but they've definitely done tissue staining and lots of things like that. So they are definitely looking at that question that you ask. And Sharon says, can you explain the difference between lipedema and lymphedema? Yeah, and so there was a fabulous article that I've already discussed before. It was talking about the differences and similarities between those two conditions. And they kind of end up at the same place, but they start at completely different start points. So lipedema actually starts with excessive fat tissue deposition that then becomes pathological, and you develop a lot of times fibrosis and edema or swelling. Whereas lymphedema starts out with excessive fluid or edema that then you can then develop fibrosis and excessive fat tissue in that area of impairment. And so you can kind of end up with in a very similar place. And so lipedema is considered more of a fat disorder, a connective tissue disorder, a lymphatic disorder. And lymphedema is considered primarily a lymphatic disorder. So they start at different places, but the tissue pathology becomes very, very similar. Lymphedema, you can be either born with an impaired lymphatic system, or you can have some kind of trauma or surgery, typically cancer treatment, that then leads to the impairment to your lymphatic system. Lipedema, we don't know. It could be a genetic cause. It could be a hormonal thing. It could be a metabolic thing. We still don't know on that one. Thank you for your great comments and questions. This article took me a little bit longer to talk about, so I'm getting short on time. I want to see anything else on here I should address. And you know, talking about Jan talking about compression. Yeah, and compression for your lymphedema and or lipedema, useful for both. But if you have one leg that has more lymphedema than the other, it might be a different product that you need on the other leg in order to make them both be equally comfortable. Excellent comments, and we probably should do a thing just on compression. And if you have an obstruction, that could cause an issue specifically to give you lymphedema on top of your lipedema because of the obstruction in your lymphatic system. So, and it could also be an obstruction in your venous system, very common actually in the left groin, May-Thurner's syndrome. It's just because of anatomically, we are a little bit different on our left side than our right side, and things lay across each other differently. And so a major vein leaving your left leg can get easily compressed, and that can make more swelling in your left leg. So if you have more issues with your left leg than your right, and they're pretty uncomfortable, always worth going to a vascular specialist and having them test you, examine you for May-Thurner's. And then Christina says, how about having C-sections? Is there a link between that and lymphedema? And, you know, anecdotally, we are seeing that a lot, Christina. People are commenting on that a lot, that it seems to be not only the hormonal changes, but also, so the hormonal changes of pregnancy, but then also the surgery. And are we doing something to actually disrupt the lymphatics when you do that C-section surgery? So that could be a link between lipedema and definitely also with lymphedema. And I think it's something that needs to be looked at more. So that's an excellent point and excellent question, Christina. Thank you for posing that. Wow, you guys are very active and putting lots of stuff. This is wonderful. And then Jan, you wanted to spell that for me, and I'm going to put it, Gail, in the private chat so you can put it, post it. But it's, of course, it's two doctors that named it after themselves, right? And so it always makes it more difficult for us to know how to spell things when we're trying to do that. But it's May Thurners. And so Dr. May and Dr. Thurner looked at that syndrome. And it just happens in the left leg. And I will tell you also a unique thing about that syndrome is that it doesn't, the foot doesn't swell. And, you know, typically with our lipedema that we notice that we don't have any foot swelling in either leg. But then if you start getting the left leg starts getting bigger than the right, but your foot is still not swelling, then I would definitely look at May Thurners because it usually does not have the foot swelling. I've had patients that had completely normal, no lipedema, both legs, but their left leg was much larger than the right, but the foot was not swollen at all. So that always makes me think about May Thurners. So check those out. And Jan says her foot is not swollen. So it's something that to rule out. It's not a super common thing, but it does come up a lot in the lymphatic community. Carla says, what physicians focus on lymphatics? Good question. It is my experience, cardiovascular MDs do not know much about lipedema. Also an excellent point. So now it's coming more common for your PCP, your primary care physician might have heard about lipedema. If they haven't, give them an article about it. And, you know, feel free to email me and I can hook you up with some good articles you can take to your physician. So I'm at leslyn@lipedemaproject.org. But we also, your cardiovascular, especially your cardiologists, are not going to know about lipedema. They know about edema associated with heart trouble. And that's the kind of edema that they're familiar with. They may not be familiar with lymphedema. So, but there are now more and more vascular specialists that do know lipedema. But again, in your local community, you may not have one that does know about it, and you can bring them that article. You know, try to increase the awareness of your physicians. Let them know that there is a code, there's a diagnostic code for lipedema. And if you've been diagnosed, you want that in your chart. Who was that we were talking to that said, my dentist even put it in the dentist, put it in the dentist chart. Anywhere you have a medical record, if you've been diagnosed with lipedema, tell them to put this code in your chart so that that is noted that it is one of the conditions that you have. And, you know, you might get some healthcare providers say, oh, look at this, you're diagnosed with this condition. I don't know much about it. Oh, well, here you go. Here's an article about it. You know, you do have healthcare providers that are interested and are wanted to learn about that. Hopefully they're not constricted with that, you know, 10-minute visit and they can learn something from you. And with that, I'm going to have to wrap it up today. It's been wonderful chatting with you here again today. Remember, email me at leslyn@lipedemaproject.org if you have any comments, you have an article you'd like me to review, any questions, and I'd love to converse with you some more. Thank you so much.